to F.A. Davis, coronary artery disease is characterized by the obstruction of blood flow within the coronary arteries. This atherosclerosis, or plaque within the vessels, is the primary cause of obstruction to blood flow. CAD, if left untreated, can lead to a myocardial infarction, the destruction of heart muscle from lack of oxygenated blood flow, leading to ischemia and death of heart muscle.
Someone call the doctor, I'm in pain.
Miss Khan, a 54-year-old female born and raised in South Asia, Pakistan, recently immigrated to New York City about 5 years ago. She is single and living with a few friends. Miss Khan has been non-compliant with her CAD diagnosis medications, such as her statins, antihypertensive, as well as her diabetic medications. Tonight, while celebrating and feasting post-Ramadan, Miss Khan began to experience unbearable chest pain unrelieved by rest, left arm pain, as well as jaw pain. She presents to Daytona State General alert and oriented with a heart rate of 130, BP of 140/80, respirations 26, O2 of 88, temp of 100, and pain 10 out of 10.
Ms. Khan, how tall are you?
5'11",
And how much do you weigh?
140.
Any past medical history?
Yeah, hypertension, cholesterol, CAD. Oh. Oh. Really bad chest pain.
And you took all your medications today?
No, I haven't been taking my meds for the past 2 days.
So tell me about your pain.
Yes, I woke up this morning with really bad chest pain. It's 10 out of 10.
Do you feel it going anywhere else, you feel like?
Yeah, it's radiating my left arm, abdominal pain, shortness of breath, can't catch a breath.
Are you on any medications?
Why are you asking me all these questions? Someone help! I feel like my heart's gonna stop. Oh my God, my pain. Someone call the doctor. I'm so much.
Vocera broadcast Charlie Pod. 56-year-old female complaining of chest pain, shortness of breath. Emergent, possible STEMI.
Help! Oh.
STEMI alert, Daytona State General, 3rd floor. STEMI alert, Daytona State General, 3rd floor.
Help! My heart!
2 18-gauge IVs were placed in both the left and right AC. Labs were drawn for troponin, CKMB, and myoglobin.
Okay, Ms. Khan, Trinity sent those labs out and I'm gonna get an EKG on you, all right?
No, please. I would rather have a female nurse.
Of course.
Thank you.
Ms. Khan, when was the last time you took nitro?
Before I came here.
And it didn't help?
No.
Okay,
took all 3 doses.
Gotcha. Let me get you some IV nitro and we'll see if that helps, okay?
Okay.
All right. Just take some slow, deep breaths, okay? We're gonna get you situated. We can get you hooked up to the EKG, okay?
Okay.
All right, and this is just gonna let us know what's going on in your heart. A 12-lead EKG is placed, which shows signs of ST elevation. Standing orders for oxygen, IV nitro, and aspirin were given. Morphine is also ordered, but is being held until patient consents are signed.
is so bad.
Hello.
Hello.
Miss Khan, I hear you having some pain.
Yes. I'm really short of breath and chest pain.
Okay. Well, your labs have come in, and based on your labs and your EKG, we're showing signs of a possible heart attack, okay? And so we're gonna have to go into the operating room and operate on you today.
Okay.
All right, your troponin levels were high, and so that means we have to do a stent. The patient was informed of the process of the stent procedure. A catheter with a balloon tip would be placed in her radial or femoral artery and inflated in the area of obstruction. Contrast dye will be injected to visualize the blood flow, so metformin would need to be held until 48 hours after the procedure. Patient was made aware that a permanent stent may need to be placed to keep the vessels open depending on the severity of the obstruction. We might have to give you some blood thinners. Okay, but we're going to make sure there's no pork products in there. We're going to use meds that are correlating with your beliefs.
Yes,
all right,
thank
we're
you.
going to take that into consideration.
Thank you.
All right, do you have any questions, any concerns for me?
I do feel scared,
Okay.
but if you don't mind also letting my parents know
Okay.
what's going on.
I'll be sure to give them a call because we want them to know what's going on, make sure you're good and that they're praying for you, right? The patient's parents were called and notified of the procedure. Though advanced in age, their approval was important to the patient and therefore important to us. The consent was left with the nurse for patient to sign, and standing orders for STEMI alerts were confirmed and initiated. All right, I'm going to go see if we can get a priest to come in and pray with you,
Yes,
all right?
please. Thank
All
you.
right. Take care.
Thank you.
How you doing, Miss Khan? I'm the hospital priest. The doctor told me that you had some concerns for your procedure coming up.
Yes, I'm very scared. I don't know what's going on. This is all so fast.
Yeah. Was there anything we could do that I could relate to them to make your stay a little bit more comfortable?
If you don't mind, I do pray every 4 hours in my culture. If you don't mind, we do like our praying direction east.
Okay, Miss Khan, we can get that done for you, and I'm just gonna say a quick prayer for you before the procedure, okay? Miss Khan was taken to the cath lab to get a percutaneous coronary intervention, a minimally invasive procedure using moderate sedation to check for any hardened plaque buildup and remove any blockages in the coronary arteries that are caused. Because of the quick 90-minute door to balloon time, Dr. Muhammad was able to restore adequate blood flow to her heart by widening the arteries and placing a stent.
Let's bring that bed down. All right, Miss Khan, how are you feeling?
Feeling good.
Yeah?
Yes, tired.
Yeah?
Yes.
Well, surgery went great. You did a great job in there.
Okay.
We were able to go in through your radial.
Okay.
And we were able to clear up some blockages. Patient was informed that a mesh stent was placed in her coronary artery in order to open up the vessel and ensure adequate blood flow. Some of your pain should be going away. And you will need to do some lifestyle changes, but your nurses will get into that in a little bit later so you can make sure we don't have to come back in here. But you did a great job coming in when you did.
Yes, thank you so much. Thank you all.
Oh, no problem. It's our pleasure. All right? So your nurses will be in, all right? Do you have any other questions for me today?
No, but I do have a question. What is this?
Oh, yeah. So this is a pressure band because this is the arm that we went through. And it should stop the bleeding and prevent blood from leaking under your skin. So it should be on for about 30 minutes, and then your nurse will come in to remove it.
Okay.
All
Thank
right?
you.
And just make sure you lay flat until then, okay?
Yes.
Don't get up.
Yes.
All right. See you soon.
Thank you.
Knock, knock. Hi, Miss Khan.
Hello.
Sorry, I hear your procedure went well.
Yes.
Really glad to hear that. So we're going to get you prepared for discharge, okay?
Okay.
You don't have to have an overnight stay. We have a dietitian. He's going to come in and explain to you about some, lifestyle changes regarding your eating habits. If you're able to withstand, light exercise, that'll be good.
Okay.
Nothing too moderate. Don't want to put any strain on your heart, okay? We're also going to start you on warfarin. It's going to be for home use, okay? It has no pork products in it, so you'll be okay, okay?
Okay. All right.
And your family's in the waiting room, so they've been notified. They're just waiting out there for you, okay?
Okay. Thank you.
And did you notice we turned your bed to the east for you?
Yes,
Perfect.
I really appreciate that.
No
Thank you so
problem.
much.
You're welcome. Were you able to pray?
Yes.
Okay, perfect.
yes.
We're going to get you discharged, going to get these leads off of you and these IVs out, and then you'll be prepared to go home, okay?
Okay.
All right.
I was educated on the importance of being compliant with my current home medication, plus warfarin, to prevent clot formation to the stent that was placed in my heart. I need to watch for signs of blood in my stool, gums, and urine. To minimize bleeding risk, I should use an electric razor and soft toothbrush at home to ensure proper care, and follow up with PCP as soon as possible.
Thank you, God, for a successful surgery. Thank you. Hello.
Hi, Ms. Khan. I'm just with dietary, and this is just a menu to go along with the lifestyle changes that Dr. Muhammad was talking to you about for your post-surgery, okay?
Okay.
So here's just some options for you to eat. We have like some lean meats like skinless chicken and turkey and, some eggs. And is there anything that you normally eat that maybe we could make some substitutes for?
Yeah, in our culture, we don't eat pork.
No pork,
Yeah.
okay. Well, that's good. Yeah, because that's not a lean meat, so that's something we would want you to kind of steer away from anyway.
I was educated on the importance of following a low-sodium cardiac diet. I was given suggestions of healthy Pakistani meals that I can still enjoy while being on this diet. For example, bindi masala, chicken keema, and lobdia masala. I was encouraged to bake my meals instead of frying them, and to cook at home rather than to eat out. I was also advised that while taking warfarin, it is essential to keep my daily intake of green leafy vegetables consistent. The nurse told me I should go for a walk 20 to 30 minutes a day after dinner daily.
All right, time to go home. I'm gonna bring you
Yes.
outside to your family, okay?
All right. Thank you.
CAD is the leading cause of heart attack in the U.S. With proper diet and exercise, it can be prevented or managed. While some may experience no symptoms at all, if you or a loved one is experiencing signs and symptoms such as pain radiating to the jaw, neck, shoulders, and arms, as well as dizziness, weakness, sweating, and nausea, do not delay. Seek emergency care immediately. Your healthcare providers will ensure special care is given not only to your health, but also to your cultural and religious preferences.